digitally enabled and empowered moms. So our goal is providing comprehensive support to women of reproductive age in Lagos and Ekiti states, providing them with the digital tools to build their physical, emotional, and financial well-being, supporting them to be able to manage their health, right? And be in control of their health, build their self-efficacy, control their finances, and build their resilience. So you can see it's a holistic approach. We're addressing all the various elements that affect a woman's health. And like I mentioned, we're implementing this project in primarily in Lagos State and Ekiti State. But we have many family members, many folks joining us from different states and different even countries. We have someone joining us from Ghana and the like. So we are glad that all of you made the time today, and we're sharing amazing lessons from this session. Thank you so much. So next slide, please. Just confirm that you can still hear me, Dorothy.
Yes, Lisa, I can hear you. I think I moved my slide.
All right, thank you. It's moved. Thank you so much. So like I mentioned, the Digital Mom Project is providing comprehensive supports, right, to build the physical, emotional, and financial well-being of women. And we're leveraging technology, leveraging data, leveraging trainings, to provide holistic support that improves maternal health outcomes, right, in the geographies where we are implementing and serving. Next slide, please. So I think there's a slight glitch from my end or a lag. Okay, brilliant. Thank you so much. So like I mentioned, I've run through a bit of our agenda already by welcoming us to the session, just running us through. We'll take a few housekeeping rules. We'll run through our pre-quiz. Our speaker, who is already in the session, who can't wait to share with us, is going to present or give her didactic presentation on knowing your health numbers, the what, the why, the how, why is it important to know and understand these numbers? Why is it important to track them? How can you manage them effectively? How can you ensure optimum health and well-being and wellness as a woman of reproductive age, right? So it's important that we listen in, we take all the learnings that we can take from this session and ensure that we're living healthier and happier lives. I just want to highlight that it's interesting that data shows that 1 in 3 women suffer from anemia worldwide. About 40% of women, have undiagnosed high blood pressure. And yet just 1 in 5 women are aware of their health metrics. So you can see the importance of us having this session today. So I want to encourage everyone, make sure that you are present, right? And you are participating. It's going to be an interactive session. Please share your questions in the chat box. If you'd like to verbalize your question, you can use the raise hand function. Just know that this session has been specially tailored for you and want you to take everything that you can take out of it, okay? So thank you very much. Next slide, please. Okay, there's a slight lag. The slides are not changing from my end. All right, Dorothy, can you hear me, please? Just so maybe we can stop sharing and start again. Please, can you confirm that you can hear me? Okay, great. All right. Okay, it's changed from my end now. So just like I mentioned earlier, we'd just like to let us know that we're collecting data around your registration,
Yes,
participation.
I can hear you loud and clear.
Okay. There's just a slight lag, so I was wondering if maybe we should stop sharing and share again because it's a bit delayed. But I guess we can go on. So I was just highlighting earlier that we're collecting data and information around your registration, your participation, your charts, but want to assure you that your data will be treated with utmost, only by the authorized personnel and with utmost care. Also just highlighting that if you have any challenges, just give me a second so that I can pull up the slides from my end as well. Okay, so we'd like to encourage you to please have your cameras on. If you need to speak, please use the raise hand feature. We'll provide that support for you to be able to verbalize your questions or comments or contributions. And we encourage you to use the chat function, questions, answers. We're here to support you if you need any technical support throughout the session. Our team members are on hand waiting to support you. But before we go on quickly, I just wanted to speak a little bit about who we are as MDoc and the work that we do. Okay, so MDoc Healthcare is a digital health social enterprise, and we provide self-care support for persons that are living with chronic health needs or regular health needs, but chronic healthcare needs like hypertension, diabetes. And we provide these people with the guidance that they need to lead healthier, happier lives. Our goal is to ensure that everyone, right, gets the support that they need to live healthier and happier and more productive lives in Africa. And we leverage a four-pronged approach. We have our Complete Health platform. We'll see a little bit about it in the next video. It's our virtual coach-led platform where members get access to coaching, building their self-care support, equipping them to better advocate for their healthcare. So you get access to digital nudges on medication adherence, follow-up appointments at the hospital, exercise, nutrition, fitness, the entire work. So our support is holistic, but we are building your ability to your self-care efficacy, okay? We also have our NaviHealth platform, which is our geocoded directory for facilities. On this platform, you can get access to look for facilities nearby you who are offering the services that you need. And you can leave reviews on your experience of care, just the way you leave reviews on Uber or Bolt, or when you go to a hotel on TripAdvisor. You can also leave reviews on your experience of care at these facilities. And these facilities will then take these reviews to drive improvements on the areas of dimensions of care that you have highlighted. Additionally, we have our MDoc Quality Network, the platform that's hosting the session we're having today. It's our capability building platform for building the capabilities of our healthcare workers, and even also training, providing education and training for the members that we serve, across our different programs. And lastly, we adopt what we call a digital approach. So it's physical and digital. So while we are very technology facing and focused, we have our community hubs where that's more like where members can go to get in-person coaching support, track their health metrics, which we'll be speaking about today, and get the support that they need to be in control of their health. Next slide, please. Thank you. So we're going to just go quickly. We'd like to encourage you. Our Complete app is available for you to sign up and get onboarded on. You can go to www.mymdoc.com. If you're using a phone that's not Android, you'll be able to sign up. But if you have an Android phone, our app is available on the Play Store. You can download it and sign up. Next slide, please. We'll take a quick video to just see how you can get signed up on Complete Health. Thank you.
This video is a brief walkthrough through our Complete Health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MDoc. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the programs to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Thank you. We can't wait to see you get onboarded on Complete Health and get access to the amazing holistic support, self-care support that we're providing through our app. And like I mentioned as well, our NaviHealth is our digital patient navigation platform where you can find access to both public and private healthcare facilities near you, and you can leave reviews on your experience of care. Next slide, please. Awesome. So we're going to get right into it. So we'll take our pre-quiz right about now, just before our speaker comes up. We'd like to encourage everyone. These are a list of questions for the purpose of measuring our knowledge gain. Please note that your answers are completely anonymous, so do not worry about it, but we just want to be able to see how much you've been able to gain from the session. So we'd like to launch the poll right about now and encourage you to please participate in taking the quiz questions. So just confirming that you can see it, please let me know if you can see the quiz questions now on your screen. If you're having any technical glitches in seeing the poll on your screen, please look for the triple dots at the bottom of your screen, more, and you should be able to see the poll questions. But if you're yet to see, please let us know. Someone in the chat will provide support for you. Thank you. Thank you so much for your answers. I can see the answers are coming in already. Please keep your answers, your responses coming in. These questions are just to, if you're just joining us, we're taking our pre-quiz now. We just want to see, measure your knowledge gain from the session. Our speaker will be coming up shortly, but before then, we want to quickly run through this list of questions. Thank you for your participation. I'm excited at the way these responses are coming in. Please keep them coming in. Thank you, everyone. If you've just joined us, we're currently taking our pre-quiz tests. Please make sure that you're participating in the pre-quiz. If you've yet to see the pre-quiz, let us know. We'll also provide support so that you can participate in the pre-test quiz. Thank you, everyone. Also highlighting that we'll be sharing the questions via YouTube as well, so that if anyone is joining us, if anyone is live streaming the session, you can also participate in the pre-test quiz as well. Thank you. The quietness in the room feels like one of those WAEC or JAM exam rooms. I can see that we're working hard at getting the right answers. Well done, everyone. Please keep your responses coming in. We're doing so well. Thank you, everyone who has responded already. If you're still responding, we're waiting for you because we want to make sure that you are able to complete the pre-test quiz. So please ensure you participate in taking the quiz, the pre-test quiz. Thank you so much. Okay, so we'll bring the pre-test quiz to a close right about now, and we'll go right into our didactic presentation. Oh, so apologies that the pre-test quiz already ended, but we'll take a post-test quiz afterwards. Thank you so much for your enthusiasm and your excitement to be a part of this. All right, so it's my utmost delight to welcome our special esteemed guest speaker today, Dr. Chito Umenyuwana, who is the CEO of Tabitha Medical Center and Arabella Women's Health. She's a fellow of the American College of Obstetricians and Gynecologists with almost 2 decades of experience in women's health. Are you even ready for today's session at all? 2 decades is not being so. Okay, she's the CEO of Tabitha Medical Center and Arabella Women's Health, a reputable private hospital in Abuja, Nigeria, where she provides comprehensive and compassionate care to women. She's a passionate healthcare advocate and a TEDx speaker who champions the cause of improving access to and quality of healthcare, especially for vulnerable populations. Dr. Chito also hosts a podcast, just in case you were wondering. So she has forged strategic partnerships between the private health sector and the government and has initiated free women's healthcare programs. Thank you, Elizabeth, for the drum rolls. I expect to be seeing more of this because the person I'm about to introduce is coming, is heavyweight, okay? All right, and you can see her passion for women's health. She has worked in collaboration with the FCT Primary Healthcare Board and as a board-certified OBGYN in the USA and a registered medical practitioner in Nigeria. Dr. Nwanna leverages her global expertise and local insights to deliver innovative and impactful solutions for the Nigerian healthcare system. Ladies and the few gentlemen in the room, I want to encourage you to please keep the claps coming in the chat as Dr. Chito comes up to take her presentation. All the claps, all the whistles, all the balloons, all the strings. We need to make sure that, because if she's not feeling the claps, she can say she wants to log off now and go home. So please, let's celebrate Dr. Chito. Dr. Chito, thank you so much.
Thank you very much. What a huge introduction. I don't think I'm big as that. I'm simply a doctor doing what God called me to do, and it's in women's health. So hopefully we have this talk and you guys learn a lot from it. It's really weird for me sometimes because I'm so used to giving big women's health talks, like on topics that tend to drive, like, oh, come talk about fibroid and all these major other women's health issues, or how can we reduce maternal mortality and all that. So when I was asked to talk about the metrics, I'm like, honestly, at first I was like, no. And then I now realized that we forget to talk about the foundation of all health matters, put it that way. And so I'm so glad to be given this opportunity to talk about basics that you all have to learn yourself, because our job as doctors is not just to treat you, but to give you the tools to make your life better, to make your health better. So we can start the slides and I can just go through the slides with you all. And I hope I do a okay job of this. And that'll be a good thing if I can get you guys to leave here thinking and being empowered. Because I always tell people, we talk about empowerment and gender equity all the time, but we don't understand that health is a core of that. And if you're not healthy, you cannot really be productive. You can't contribute your quota. So I hope I change someone's life by the time I'm done with this presentation. So I'm just waiting. Are you guys sharing the slide or?
Yes, we are.
Okay.
Dorothy, is it changing from your end yet? All right. Thank you.
The next slide, please. Perfect. All right, so you can see, let's go back to the title. Let's go back to the slide before that. Then I'll just let you guys know when to change over. The title here, about health metrics, and I put it as empowering women's health, because that's really what I advocate, is women's health, empowering women's health, and the key metrics for women of reproductive age. Okay. Now, even if I'm focusing on women, the men on this group should know that what I say literally in this kind of conversation applies to you as well. So you're not left out at all. Next slide. All right, so as I said already, our goal is to empower you all with knowledge and tools to manage your health effectively and to monitor your health. So we're going to cover that here, the essential health metrics, their importance, and practical tips for maintaining good health. So we keep using this World Health Metrics, and I'm going to just simply explain this to you. They're measurable indicators. So sometimes you come to the hospital and say, I'm not feeling well. And we'll say, okay, we can see you're doing okay. What does doing okay mean? We're looking at certain metrics, certain numbers, certain things that we can actually measure that reflects the state of your health. So that's what we are calling health metrics. Things like here, we're going to talk about blood pressure. We're going to talk about anemia, which is low blood level. We're going to talk about blood glucose. We're going to talk about your BMI, which is a big thing right now where it concerns wellness and everybody trying to get fit. That's measuring your body, how are you obese, what your weight is pretty much. We'll talk about that more. And of course, mental health. Mental health, people ask, is there a metric to mental health? We do also have assessment forms and all that for mental health. And I'm happy it's included in the metrics today, because speaking up about it in an environment where stress is so dominant is very important to remove that stigma and encourage people more to seek help, okay? Now, the first metric we're going to talk about is blood pressure. Every time, talk to someone, they have a headache, like, I think I have high blood pressure. Well, there's a number to that. What is blood pressure? In your body, you have what we call vessels, right, that carry blood around your body. But let me give you a better image. You know how we have like the water pipes, the pipes that are, used to water your flowers, the garden, or whatever, the pipes. You remember the water flows through those pipes, right? When the pressure is high, you see the high flow and it comes out with force. When the pressure is low, very low, you see there's like drip, drip. Your vessels can be likened to these pipes. So when we talk about pressures, what pressure is your blood flowing through these vessels? And we want to make sure that that pressure is a healthy pressure, is not too high, is not too low. Because the blood vessels, as you go along, the blood carries certain things in it called red blood cells and oxygen that needs to go to different areas. And we don't want the pipe to burst. Remember that, like, if you have a pipe, a normal water pipe, and the pressure is so high, what happens to the pressure? What happens to the pipe? It could burst. And that's what we call in the human body a stroke. So it's very important that we measure these blood pressure, these numbers. These numbers are very important. There's a top number and a bottom number, right? So the importance is that we want to maintain normal blood pressures to reduce the risk of heart disease, stroke, and kidney problems. We want to make those vessels to be intact that are carrying blood around your body, and we don't want any damage to them, which can lead to damage of the organs that they supply. So in the pre-quiz, you guys had a question. You can see the range here of normal is 90/60 to 120/80. But I want to note that as you grow older, so someone that is 60, for example, I wouldn't be surprised if their blood pressure is more than 120/80, because just like the regular pipe, as it grows older, it gets stiffer, and you need more pressure to push the blood through a stiffer pipe or through the stiffer vessel. The vessel gets really thick and gets So as you grow older, we expect your blood pressure baseline to be higher. So when you say, oh, but my doctor told me that I'm 130/80 and I'm fine. Yeah, that's fine, because for your age, if you're older, that's normal. But for the reproductive women less than menopause, we try to keep your blood pressure to be around 120s/80s. Next slide. Now, most times people walk around, especially in our climate, because we're not very good with going to the doctor annually. And that's something I really am going to be emphasizing throughout this discussion, that you need to be checked out. You need to really, once a year at least, to measure this and see where you stand. So we're going to talk about risk factors. What makes some people more predisposed to having high blood pressure than others? One is family history. When I talk and ask someone, do you have anybody in your family that has high blood pressure? We normally laugh about it, because life these days around the world, not only Nigeria, is getting really, really stressful. And a lot of people say, I think everybody has high blood pressure. But really, family history is really important. If you have a dominant history of your father, mother, your sister, everybody has high blood pressure, more likely than not, if you're not careful, you could have it as well. High salt intake. This used to be my little crime back in the days. I would not take sweet things, but I love chips. I love putting salt, extra salt in everything I eat. And this is very dangerous. And I was happy I found out early that it is dangerous. And so we try to tell people to minimize salt intake. Obesity, you're going to hear this again throughout. And this is why BMI is very important, because when you're overweight or you are obese, meaning that you're above a certain weight that we're worried about, you can have risk factors to these things like blood pressure. Lack of physical activity. We cannot be lazy. We cannot be glued to our screen. Even at work, that you should be able to move at work. You should be able to get those steps in. And I'll talk about that as well. And stress. Now, stress is a huge topic of itself. And people say, how can I avoid stress? You may not be able to necessarily avoid every stressor, but there's ways to manage your stress as well. All right. Now, symptoms of high blood pressure here, I put headaches, dizziness, shortness of breath. But let me tell you the truth. Blood pressure is one of the most asymptomatic, meaning that you do not have any symptoms and you're running a very high blood pressure. That's what makes blood pressure very significant. Most people don't know. I had a patient the other day who came in for something else, and all that, checked her blood pressure, was almost 200/100 and something. And she was like, how? I don't think that's my blood pressure. Well, we rechecked it after a while and it was about the same thing. And she doesn't feel any symptom. And I told her it doesn't have symptoms. And so that's why we worry about it, because sometimes you walk around with high blood pressure and then boom, something happens. And that's when I've had someone that just found out he had high blood pressure when he had a stroke. So it's very important that I'm not trying to scare you. I'm just trying to encourage regular checks. So that you are aware of what's happening in your body, okay? We say the home monitor. I always prefer the home monitor for those that already have issues with blood pressure. I just believe that coming into the doctors once or twice a year to check is enough. And of course, maintaining a healthy lifestyle. This is going to be a bit interactive. I'm going to be looking at the chats a lot. If I'm moving too fast, please let me know. I'm so time conscious when I'm given a timeline, but I don't want you guys to miss anything as well. Next slide. Now look at how the guy is sitting. A lot of people have blood pressure monitors at home, but they don't know how to take it, and they come with all these bizarre numbers. This is really how you should take it. You should actually sit down on a table with your back supported, arm bare and supported. The cuff normally stays about 3 centimeters above that elbow crease. That's where it stays. I don't normally solicit for this wrist cuff. I think his numbers are always off. I prefer you getting an arm cuff. I think that's more accurate, okay? And then you do not talk or move. That's not the time to be on your phone, because your blood pressure will just be wrong during the measurement. And you have to uncross your legs and put your feet flat on the floor. So this is the proper way to take blood pressure when you're doing it by yourself at home, okay? And next slide. This is just giving you a visual. I love pictures. When I present, I find it so boring if there's only words, but I think pictures carries a lot of weight, and I love pictures. So this is really giving you a kind of a visual of what could happen if you don't control the blood pressure. So if you have blood pressure, it's about just finding ways to control the blood pressure. That's it. And this is really what happens in that circumstance. If it goes on for too long, too high, too long, this is where it may happen. Next slide. this just gives you how we look at it from the health perspective. You know, the healthy blood pressure range, the elevated blood pressure range, stage 1 hypertension. I mean, these are things that by stage 1, we're really talking about lifestyle changes, not necessarily medication, just increasing your physical activity, lifestyle changes, reducing salt intake. That's really what happens in stage 1. Then stage 2, we start talking about medications and how to lower those blood pressure. And we never want people to get to stage 3, which is hypertension crisis, which is where we have to admit you and it becomes an emergency. Okay, so this is the number where we don't want to get to. Next slide. All right, anemia. Anemia, as a gynecologist working with women, anemia is something we see often enough because of the fact that women tend to have different bleeding patterns at least once a month. Some people even have it twice a month. So anemia is something and a condition that we look out for significantly, right? So what is anemia? Anemia is when you lack enough red blood cells to carry oxygen to your body's tissue. Remember, I spoke about the vessels being like pipes all over your body carrying blood around, right? In that blood, you have red blood cells. And these red blood cells, okay, these red blood cells have oxygen in them. They carry oxygen and they take the oxygen to different tissues and provide them with energy. Oxygen is like the energy in your body to do what it needs to do, right? Now, if you have anemia, you don't have enough of those red blood cells carrying oxygen to parts of your body. And that deprives your body from the energy that it needs. And so that affects you as well. And common types we usually see is iron deficiency, folic acid deficiency, and B12 deficiency. Everything we mention here is like a topic of its own. So I'm going to just focus on the metrics, but I want to say something about B12 deficiency because we hear a lot about iron replacement, folic acid replacement. B12 is equally important. And sometimes without B12, sometimes you get really tired. Most people get it in their meats because animal origin, like meats and stuff, are very good high in B12. But many people don't ever check B12. And I understand in Nigeria it's quite expensive to check, do that test, but it's also relevant. It's quite relevant if you can afford it. Or you make sure you improve your diet to supplement for it. Because B12 is not made in our body at all. It's either diet or supplements, okay? And B12 is actually in charge of creating and making red blood cells and white blood cells and platelets. These are all different cells in your body that one blood levels, I tell you about the blood level, white cells fight infection, and platelets help your blood to clot when it needs to clot. So B12 is very important. Even memory, cognitive memory, attention, and things like that. B12 actually is very key in that way. So, but that also leads to anemia and low blood level as well. So I just wanted to talk about that because people normally don't mention that. We can see the risk factors for anemia, heavy menstrual periods, yes. I know that's something I see commonly when people have very heavy flow, and we work really hard to make sure that we reduce that, and we have different ways of doing that. Pregnancy causes anemia, leads to anemia. Pregnant patients are more likely to have anemia because also of the changes that happen in the body during pregnancy. So we look out for that because we know that it's very important that we treat anemia in pregnancy because it can lead to poor outcomes. Poor diet, people not eating properly, chronic diseases, so people going through chronic ailments as well. People normally tell you they feel generally tired, weak. You can see they're pale. When it's really, really bad, they get palpitations, heart racing, shortness of breath, and dizziness. They get all those, I go outside and I feel like fainting. So that's one of the symptoms. These are the few symptoms of anemia. And we need to also check it because women were already predisposed, reproductive age women are already predisposed to having what we call anemia based on our monthly cycles. So what do we do? Regular blood tests, but always diet. You know, having a balanced diet is very important. Next slide, I can show you. This is just a range. It's kind of technical, so I don't want to dwell on it, but this is just us looking at range. And of course, we look at more, when we look at numbers, we also look at clinical, the whole picture to see whether we should be worried or not. So this is just what we look at. Of course, severe anemia is anything less than 8 hemoglobin. And so we don't want you to get there at all. But we see that, we can see that in pregnancy. We can even see that in a woman who is bleeding so heavy. And that's why we always tell people, we're bleeding so heavy like this, come to the doctor to get managed because we don't want you to get below 8. Next slide. This is just an example of iron-rich foods. You can see it on your screen. I don't want to go through it because of time, but these are just to give you an idea of how you can get iron. I always laugh and say, I don't think I can ever lack iron, because another thing that I really love that has good iron is plantain. I can eat plantain morning, afternoon, night, for those that know me. So I was like, with the plantain I eat, I doubt if I can ever lack iron, especially on ripe plantain for those that like that as well. But they're just different meals that have high content iron. Liver, I hated liver. As a child, I hated liver now, but people love liver. And so this is another thing that, you can also eat and provide high content iron. Spinach, vegetables. We know about, there's something that we talk about to patients when we do surgery. We tell them to do that. I heard this first time when I was in Nigeria. I laughed, so a hospital no fast, something like that. And it's a vegetable, and the real name of the vegetable is so long, but people use that as well. Ugu, everyone knows about ugu, and just the ugu, I would tell them ugu smoothies and all that. They're really high in iron as well. Next slide. Blood glucose, diabetes. I'm seeing more and more. I don't have the statistic off my head. I wish I put it here, but I'm seeing more and more people coming, younger age for that matter, with the diagnosis of diabetes. And so I feel that we're becoming more prominent in diabetes. And so being able to understand this is very important in preventing you from getting it. And also if you hear you're pre-diabetic, in preventing you from going into diabetes. And then if you're already diabetic, helping you to understand how to manage and why it's important to manage your sugar, and to know that if you're diabetic, you're still live a very healthy life and do healthy things by doing the right things. So this metric is very important. It really talks about the amount of sugar in your blood. It helps to manage energy levels and prevent diabetes. So you look at your blood glucose range. We'd like to see fasting. Fasting means before you eat. So early in the morning and before, like, I think 10 o'clock or so, we normally see as doctors, because after a while, your body goes into starvation mode and then breaks down its own sugar. So your lab result then will be wrong. So we try to do fasting early in the morning. And after meals 140. This is almost like I'm looking at pregnant women numbers, because I know for the internists and for normal adults nowadays, they're more flexible with numbers, like after meal, random sugar above about 200. They're not really worried about it as well. So the numbers are you have to just look at your certain clinical situation to know what numbers are appropriate. Next. But the test I really like for checking your diabetes called the hemoglobin A1C. People use blood glucose a lot, but this is really now becoming more relevant for us to test. Why is that? When I check your blood glucose now, all to show me is what your sugar is now, what your blood sugar is now. But when you do this one called the hemoglobin A1C, it tells me what it has been in the last 2-3 months. So it gives me a clearer picture, like, is this person really is that person diabetic? Is the person having a high sugar for over a period of time and not just today? Maybe today she ate something bad in the morning, or she ate something bad last night. So this gives you a better picture. And we use this a lot to really diagnose diabetes. So if your normal is 5.7%, pre-diabetes is 5.7 to 6.4. So, and then diabetes is 6.5. Some people say, okay, they're 6.7, but I use 6.5 or higher. And this is very important to know, because if you're in the pre-diabetes range, we try to modify things and to manage you in a way that you don't get into diabetes range. But again, these numbers are what I use because it gives you a better sense of what the person really is over time, as opposed to what you are right now. And I think that's why this has really taken a lot of, many doctors now use the hemoglobin A1C as their guide to diagnosing diabetes. Next one. What are risk factors? And I always talk about risk factors. Even when you come for your wellness visit with me or anything, I always sit down. I want to know, I need to identify if anything in your life story puts you at risk for certain conditions, so that I can now tackle those things, or make sure I plan ahead for you to make sure that we don't fall into that, or I give you tools to make sure that you don't fall into these conditions. Because that risk factor is just something telling us, is she predisposed to this? Is she someone that could most likely have this? And how do I help her prevent getting there? So family history of diabetes, poor diet, physical inactivity, obesity always comes up for that. People that the symptoms really are mostly, they get really thirsty, you're peeing all the time, you're tired, blurred vision, Those are the common symptoms, and then among the other ones that you may have. So again, I'm going to say regular blood tests. I'm sure that by the time I finish, all of you on this chat will go and make sure they schedule their wellness visits, even if they haven't, or at least go and get your metrics checked out. I mean, MDoc has just talked about where they have the hub and all that. Get your metrics checked out because it's so worth it. It is a good starting place, to do, because I can see, I say monitoring. It's always regular tests, maintaining balanced diet, and exercising regularly. Next slide. This is just a picture kind of showing you like the normal blood glucose, the high blood glucose. So just so the glucose are the little yellow pellets in there, just to show you how maybe the blood kind of looks, give you a visual impression of when something is excessive. Next one. I'm going to tell you to ignore this a little bit because I don't want you confused, but this is just pretty much how we look at managing people that have high numbers and where we categorize them. But I don't want you guys to get confused. It's very a bit technical. Next slide. Glycemic index. Why I'm throwing this in is when we talk about what we eat, I want to introduce something called the glycemic index, which is a scale that ranks food based on how much they raise your blood sugar levels after eating. Some food will give you very high blood sugar levels, some food wouldn't. And we try to recommend choosing the low glycemic index foods because it really helps to, manage blood sugar levels better and reduces your risk of diabetes. So these are just the numbers, and sometimes these foods are categorized based on numbers. So low glycemic, we say 55 or less, and I'll show you a picture next. Medium, 56 to 69, whole wheat products, brown rice, and 70 or more is high glycemic index. You find foods that we actually even recommend, like oatmeal. Oatmeal has a high glycemic index, but we recommend it. And I always tell people that oatmeal is healthy in that way because it has high fiber and everything else, but you must manage the portion of what you take. There's nothing, everything sometimes it has to do with portion as well. Next slide. I'll show you a bit of this gives you an idea sometimes of some foods and their numbers. If you look at the numbers and food, you can see how some have a lower glycemic index than others. And sometimes people adjust that number and all that, but it's good for you to go out, not everybody's tech handy, to look at different tables about high glycemic food and all that, and see what it contains and all that, and how to portion them. Because I always feel that everything's about portion. I love when I talk about weight loss and I talk about diet, I always talk about portion. I feel that when you take people completely off what they like, they tend not to, it's not a lifestyle. So I like people understanding some key elements when it comes to nutrition. Next. Body mass index. We hear BMI, my BMI. What is BMI? It's really just calculating, it's a height and weight measurement that we use. So we measure your weight above your height squared. That's maths, but that's what we're looking at to give us. So based on your height, what is your weight? Because sometimes you're short, your BMI might be higher than because you're short and then you have a particular weight and you're like, but she and me are the same weight, but because you're shorter, your BMI is higher. So it's a kind of a measurement that helps to just put this into perspective when you're weighing. I want to also say one of the things I worry about the BMI is with black women is that we have hips and more of that, and I feel sometimes it's not integrated into the BMI. So I also look at that as well when I'm counseling people about your BMI. But a healthy BMI is usually considered 18.5 to 24.9. Anything greater than 30 is considered obese. All right. And this is a metric that we use to guide us. We also do some other measurements here, like abdominal circumference, measuring around your belly button area, to also show us, again, your state of health. And that means the bigger your abdominal circumference is, the more high risk for you to have diabetes and high blood pressure and all these other medical conditions. So these are the metrics we use to also say, look, your BMI is high. You're putting yourself, like we saw there, at risk for a lot of these issues. Next slide. And what people don't understand now, we're seeing also a link between BMI and things like cancers as well. We're seeing a lot of the fact that people don't know this. Everybody looks for the tab. Everybody's coming, what supplement can I take to reduce? Everybody's looking for supplements to reduce risk of cancer, this one. And I said, have you heard of the latest one? They say, what? I said, exercise at least, for like at least 5 times a day for like 20 minutes at a time. Exercise will reduce your risk at least by 1/3 of getting cancer. And they look at me like, no, we want something that we can take by mouth. Well, the truth is, healthy lifestyle reduces your risk of cancer. And that's just the truth of that one. And one of the ways, again, balanced diet, regular physical activity, monitor weight regularly. All these things are really topics of their own. So I'm just touching on them. And when we ask questions, I can go deeper for those that I can, do within the time frame. Next slide. This just gives you another visual look, again, of what I mean by the normal. So you see normal, you see overweight, you see obese, and you see morbidly obese. Which again is very high. Like when I practice in the US, I see a lot more cases of morbidly obese than I see when I am in Nigeria. So it's pretty much, it's a significant issue as well. And now that we're getting a lot of fast foods in Nigeria, we got to be careful, because that's one of the problems in the Western world is the fast food and all that, and that significantly affects morbidly obese. And then we also have underweight, which I didn't put here as well, which is a major issue, of course, also in Nigerian vulnerable populations where food is also an issue. Next. This is the portion plate. This gives you an idea of how to portion your food. If you're ever trying to do, then they sell this in the markets. It's so easy to get, but it's very important to look at this plate and just try yourself and say, okay, this is how I'm meant to eat. This is how I'm meant to have a balance. This is a balanced diet. I mean, no, we're not super at it. I'm not going to sit down here and tell you that I'm super at it. I'm not, but you aim to be this way. I'm going to eat my fruits, I'm going to eat my grains and my vegetables. I'm going to watch what I eat. I'm going to cheat once in a while, but I'm not going to cheat every day. So these are the kind of things that, is good to use. Next. Now, benefits of exercising, because when we talk about exercise, and this goes with the BMI, because a lot of times people want to do, tell me, what I want to lose weight, or what's weight loss? I want to do weight loss. I tell people, don't focus on the weight loss, focus on fitness. Fitness, being fit, being healthy, eating right. And at the end of the day, you might achieve your weight loss goal. You will, or may most likely achieve your weight loss goal, but your mentality and your mindset should be towards being healthy and fit. And I just showed you cardio training and strength, which is very important. A lot of people run and they don't do strength. But when you're growing older as a woman, so as you're approaching your 40s, strength becomes really important in balance, in posture, in losing weight. Actually, strength is actually more important at that point. And, and just being able to maintain that balance in your back, all those kind of things. So I think strength is also very important. So incorporating these two aspects, walking is amazing. I encourage my patients who don't like exercise to go out and walk. I know sometimes they'll say security is an issue, but then find where you can walk and aim for 10,000 steps a day. If you aim for 10,000 steps, when you go to offices, instead of using the elevator, you climb the stairs, because all you're looking at is I must make 10,000 steps for those that have the monitors on. Or you just tell yourself, oh, one day I will just figure out what gives me 10,000 steps, 2 miles, 3 miles. You gauge it like that. But 10,000 steps, when you're aiming for it, you park your car far and walk. All you're looking for is, how can I get my steps in today? And it really does have a significant impact on your fitness as well. So that's another thing. Next slide. Mental health. Mental health includes emotional, psychological, and social well-being. It's something that I advocate for a lot in women's health, because, it's so linked to other conditions. It's unbelievable. I've had patients come in with chronic pelvic pain, pain in the lower abdomen, pain here, pain there. And by the time you start counseling them and start trying to find out the root cause, or just going down, you find that a lot of stress, a lot of issues, or they're depressed. And once you solve that problem, you find out that the pain disappears. It's clockwork. They will have this, and next thing, you've done all treatments, you've done everything, is the mental health that is fixed, that they now have their pain go away. So mental health is significant for me because it's quite linked to your physical condition as well. And the stigma around it is ridiculous. There should be no stigma. It's just like me saying someone has high blood pressure, as far as I'm concerned. It's all part of your wellness, all parts of your body, it's all part of a holistic approach. So I never separate mental health from when I manage my patients. I screen, I look at what they do, if I'm taking history of anything else, I must also take history of their stressors and things they have to deal with. Yes, I did psychology before I did my medicine, but I also encourage other health providers to do that as well. We cannot let this stigma prevent women from talking. The more we speak up about it, the more people will talk about it, especially now we're going through a lot of stressors, okay? Anxiety, depression, and stress are the common mental health issues that I face in my practice as well. Next slide. So what are the risks for hormonal changes? Yes, some people say, okay, when they're pregnant, although I tell my pregnant lady sometimes, hormonal changes not give you a pass to be extremely rude. Yes, we know you can have some mood swings, but I don't give the, because people say, oh, no, it's my hormones. I'm like, no, it's not. You're just being rude. So it's very important. Menopause also is another time where in your life you get some mood swings because of the hormonal fluctuations. But again, it's manageable. Life events, grief. Sometimes people don't go through grief very well. Some people get stuck in grief, and is a dark place to be. Family history, also very important. Lack of support sometimes. Being able, doing so much by yourself, multitasking, constantly moving, constantly thinking, constantly being put. And women tend to fall into that category so well, doing everything and never once pausing to rest or to come into a place of rest, even for a minute. They feel they just need to keep doing and doing, and that causes a lot of stress as well. When we see this, we see people that have persistent sadness, mood swings, changes in their sleep, appetite. Sleep is a whole topic in itself. Sleep is so important. And when we deal with sleep hygiene and stuff like that as a topic, it's so important as a topic of its own. So hopefully one day MDoc will talk about sleep, because it affects all aspects of health, all aspects. And feeling overwhelmed, which is something that we see now when you just feel quite overwhelmed. All right. So when we talk about mental health, regular self-assessment, like I said, I believe very much in assessing patients. I cannot separate their mental health from their physical illness. I never do. So it's something I standardly just make sure I develop. And I find out that when you go into their stresses and manage their stresses as well as you manage their physical health, and you go on the journey with them, they're more compliant to your treatment plan. They're more in tune to their own health. They're more appreciative of the tools that you give them to make them healthy. They just key in and they feel better being listened to and heard. And I think that's very important. And if there are any healthcare providers here too, you must incorporate that into your practice. It's so important. People cannot be stressed, because if you are chronically stressed, it leads to distress, it leads to depression, it leads to anxiety. All right, the next slide. So when do you seek professional help? So these are I just put some things here because few things here so that it helps you to kind of understand when you should seek for help, or your loved ones beside you when you notice certain things. One thing that I will tell you that people will tell you when they're depressed, there's so many people around me, but I feel so alone. I feel I can't express myself. I feel like I'm stuck in my own stressors. And so you've observed someone you love, someone near you go through this as well. You should encourage them to seek counseling as well. Persistent sadness or low mood lasting more than 2 weeks, loss of interest in activities once enjoyed. Oh, I like you to love playing this, but I don't anymore. Significant changes in appetite or in weight. Yeah, next slide. Difficulty sleeping or sleeping too much, feeling of worthlessness, nobody needs me, I'm no value to anybody, or excessive guilt. Difficulty concentrating or making decisions. You can't focus, you can't pay attention, you can't seem to complete a task. You're forgetting easily. Thoughts of death or suicide, definitely. Anybody around you ever says they want to take their lives, do not ever say she can never do it. Please, you don't know where that person is. Get help if they don't get help for themselves. Get help for them. Next. Anxiety is something that constantly is happening more and more as well as we're looking at our situation, the whole world, everywhere. There's excessive worry or fear. But sometimes when it becomes difficult to control, then that's a problem. Restlessness or feeling on edge. Fatigue, again, insomnia, irritability, tension, back pain, lower back pain, and panic attacks. Sudden feelings of intense fear, heart palpitation, shortness of breath, and dizziness. This sounds like me when I get on a plane and there's turbulence. I'm sorry, that's where my phobia is. And it's unbelievable because I do travel a lot. But once this plane starts shaking, I think I go into a panic attack mode. I just control it. So everybody has their point of phobia. And phobia is sometimes just not a logical thing. But sometimes when it gets so much and worry, it's good to deal with it as well. All right. And I want to just do a little thing here, if just for 1 second. I don't know, I think my time may be running up, but I want to do where I want everybody to kind of close their eyes for I'm going to do really fast. And when you close your eyes, think of something that really you don't want to think. Think of something that maybe bad happened to you recently or in the past. Just close your eyes and think, okay, something that happened to me that I'd rather not think about, but it happened. Now I'm going to count to 3 while you do that. 1, 2, 3. Now switch. I want you to think of something really good that's happened to you, whether it's a promotion, whether it's the birth of a child, whether it's the last birthday you had, or someone you love. I want you to think of something that really made you happy? 1, 2, 3. Now, what I wanted to do is tell you that is what you think that you feel. When you close your eyes and you think of something bad, you wouldn't even know, but if I'm looking at your face, you're actually frowning. And when you think of something good, if I'm actually looking at your face, you're actually smiling. So a lot of times you find out that you actually think first and then feel. So when we're dealing with mental health issues, we always try to manage the thoughts. The thought comes before the feeling. And so one of the things that, we go to the next slide, one of the things we're going to talk about when it comes, next slide, please, is what are the ways in which you can manage your stressors in a way. That's a whole topic, but I just wanted to talk about something called mindfulness. Being able to think about something that would either bring a negative feeling, but you're able to turn it into something positive because you understand that with first place, your guts, where you want to get someone, if anybody wants to make you sad, they're going to affect your mind first, be honest. Because when you think, you feel off the bat. It's just what it is. And what we do in psychology is we try to change the way you think, right? Towards something. We try to change that feeling. So we get you to think and then try to attach that feeling to something positive or to make you feel like, yes, this is how I think, this is what I'm seeing, but I'm not going to allow myself to fall into the feeling process. So we give you that sense of control, and that's mindfulness, present, bring you into present, your present, so that your thoughts don't end up affecting you. Think about it. A lot of times you meet someone who offended you 2 weeks ago. That thing has passed, but there's something, you just think about something that person did, and all of a sudden you're as if you're in that particular moment 2 weeks ago when that person offended you. And so what we want you to do is realize that, no, that was 2 weeks ago. I'm fine now. So that's mindfulness, being able to be in the present space, and really does help to manage stress. Human connection, you can never deny it. When you're depressed and when you're sad, the first thing that you want to do is isolate yourself, and that's dangerous. So human connection is very important for mental health. A gratitude journal. I love my patients seeing the glass half full instead of half empty. So when they come in and telling me and it's sounding like it's half empty, I try to turn it over and say, look at it, it's half full. I've turned the timer around, it's now getting to be half full. Let's look at it half full and then think of how to fill it up and all that. So this is another way of managing stress as well. And self-compassion, self-love, you can't get enough of it, and sleep. I always make sure you fix sleep. Sleep problems, I always need to fix, because you can't fix sleep, you're not going to fix the mental health issue. And where those that need help with either medications or stuff, then you give them also that as well to support, because sometimes these feelings also have underlying medical issues that need to be treated as well. So all that is a combination of how to manage and cope. And there's nothing absolutely wrong with admitting to that you're dealing with these things, because it's becoming very, very common as well. Next slide. All right, so we're now wrapping up. This is just different ways of dealing with stress, minimize conflict and things like that. So next one. I'm sure MDoc will share the slides with you. Now, this just tells you again why you're monitoring, regular monitoring of health metrics is crucial. As I said, for early detection, preventive health is so much cheaper, so much easier than managing your health. You prevent is the best. And I've always said that. I've begged and hope the government also picks that up in terms of the people like primary care facilities, that preventive health, preventing cancer, preventing diabetes, preventing high blood pressure is so much cost effective than when you're managing. And those that are managing chronic conditions can tell you this as a fact, okay? And when you understand these metrics that I've told you, when you understand the implications to your health, you'll be empowered, because now you'll be able to make informed health decisions. So that's also very relevant. Next. So schedule your wellness check when you leave here. If you haven't already, make sure you have an annual wellness visit, very important. Use home monitoring devices only for blood pressure and glucose, only when your doctor tells you to. Please do not, because you might create another form of panic attack and anxiety that you might not like. So let the doctor guide you on this process, your doctor, your family doctor, to guide you on this process first before you go. And especially glucose, I don't want home monitoring only for those that have been told by the doctor to get it. And adopt a balanced diet, rich in fruits, vegetables. Nigeria is lucky because we farm these things, and they're organic most times, and, lean proteins and whole grains. Next. engage in at least 150 minutes of moderate exercise per week, but start easy. You can start 5 minutes a day. I went for a 5 minute walk, great. Next day, go for 10, then you build it up, then 20, then 30. By the time you know it, you will not feel good if you don't exercise. It's really important. I think that's one of the concepts I adopted in my center was like, no, we're going to do it holistically. So we also have wellness centers and programs and things like that because we want people to really be healthy all around. So it's something you should adopt wherever you are, is to have that healthy mindset that, look, I want to be empowered. I want to be successful. I want to be productive. I have a lot to do in my life. And there's no age that's old. You make yourself old. After all, if you're exercising on a day like this, 150 minutes per week, studies have shown that it takes 20 years off your life. So if I'm healthy, you might think I'm 50, but I'm 30. If I'm 40, I'm 20. So it's very important to incorporate these healthy lifestyles, hobbies, social connections, relaxation techniques, very important. Healthy habits significantly impact your health metrics and overall well-being. Trust me when I say, make this your moment. You're still half of the year. Finish the year strong. Next one. I think this is my last slide. All right. Thank you very much. I don't know if I've made an impact. I hope I have. There was a lot of information out there, but I'm hoping that somehow or the other, someone picked up one thing or the other to add to their lives.
Thank you so much, Dr. Chito. I don't know what you meant by saying you hope you made some impact. You did amazing. Thank you so much I felt like with humor, with practical tips, with relatable, tips and practical also strategies that we can all relate to, from balanced diet to managing stress to physical activity. I took all my L's, right? I hope everyone took theirs as well. Everything that you know that you're not doing right, that Dr. Chisa already mentioned, please, I hope you're noting them down. Managing stress, identifying your stressors. She mentioned something about a gratitude journal. She mentioned something about wellness checks, the importance of going to the hospital, regular checkups with your primary physician, monitoring your health metrics, all of these tips, the importance of them for not just managing your health, but also keeping you away or reducing the burden or the risk of chronic disease. We cannot overemphasize how important this session was. And I want to be seeing the thank yous and the claps and the appreciation in the chat. Thank you so much, Chito. This was very engaging. It was very enlightening for me. There were a lot of things that I noted down, even the plates. Right. Thank you so much. Yeah, the portion plate. Thank you so much. I hope that we also took something from the session. That's why I took the time to list some of the important things you need to identify as things you need to watch out for going forward. So thank you everyone for participating. I just want to confirm if there are any immediate questions that we have so that Dr. Chito can provide answers to these questions. Does anybody have any immediate question? If you would like to verbalize it, we can give you some time to speak. Okay, I'm just going to go through the chat to see if there are any questions that we may have had for Dr. Chito so she can take them.
Hi, Elizabeth. Sorry, I have my hand.
Oh, great. Shay, let's have your question. Thank you.
Hi, Dr. Chito. Thank you very much for the engaging conversation. So I think mine is not really a question, but just maybe just sort of a clarification, right? Because when you presented on the hypertension part, I know here in Nigeria, and I think even at MDoc, we use the WHO standard, which says 40-90, so
yes,
I know, yeah, I know the American the Cardiology Association, I think they use, above 120-80, but I think generally we go with the WHO standard and the, I think, JNC standard that is 140-90. So I just wanted you to like maybe speak more on that part, because I mean, from 140 or above 140-90, from what you showed us is stage 2, so stage 2 hypertension. So I just wanted you to sort of just throw a little bit of more light on that. Thank you.
I think when it comes to blood pressure issues, I think my mind, as I mentioned there was I keep on falling into this poor category of dealing with pregnant women always in my head. But when you talk about the World Health, yes, Nigeria does for World Health, and yes, these numbers are pretty much the American whatever. But again, like remember I mentioned there and I don't know if this answers your question. I mentioned there that nobody really treats to 140/90 anyways. You know what I mean? So sometimes when I look at the World Health criteria, I think they're looking at the level of which you treat. Do you understand? Or am I wrong in what you're saying? Am I getting to your answer? I'm not sure. Hello?
You are.
Because when you're talking about 140/90, nobody will treat you like nobody will say, oh, come and start any kind of antihypertensive below 140/90. And yes, I know naturally when I'm defaulting to my research or my presentation, sometimes I default to, because I trained in the US, default to the American one. But you're right. I remember when I had that discussion with a cardiologist, and he was saying that the number 140, like he wouldn't even treat, even 140/90, sometimes they'll tell you to modify your diet. While in the US they'll treat you, put you on something, so but I just feel that just different standards, but I feel that they all come to the same place because nobody would really treat you below 140/90. They'll tell you to do lifestyle modifications. Above that, then they will treat. Although most people that get to 140/90 end up being treated anyways, because many people don't do lifestyle modifications.
Okay, thank you, Dr. Chito.
So you're actually right. I didn't even put that, and I should have put all these things in comparison. I just went like my narrow tunnel US, but you're right. World Health should be what should be shared when it comes to talking to the different climes. World Health is actually standard.
Thank you, Dr. Chitam. Thank you, Shei, for highlighting that. There's a question here from Yenukume. She says, which of the plantains is better for consumption in pregnancy, ripe or unripe?
There's one thing I always say about nutrition. Of course, the one that tastes the less, the one that's not sweet is always the healthier option. Unripe is always the healthier plantain option, obviously, because ripe has more sugars, but when I talk about me eating morning, after night, of course I'm talking about ripe, but it's unhealthy. It's unripe is actually the healthy option when it comes to iron and health generally. Unripe is what I recommend for a pregnant woman.
Yeah, some of us wouldn't like that answer.
Do what I say, not what I do.
I know. Thank you, Dr.
I'm being vulnerable here. I'm confessing my sins. But unripe is the healthy option. So if you want to gain protein, I think unripe. And for healthy women, also be very careful with vegetables. Vegetables very good, ugu and the rest, but you must wash your vegetables very well. I must say, and when people if you are a vegan on this group, then you have to also make sure that you are also particular about your supplements as well. Because I'm getting people that have changed to vegan and are in anemic and all that. So it's very important that you also know that too. But unripe plantain is good. Vegetables very good. Just make sure you wash it very well. Especially if you're pregnant. For anybody, but pregnancy sometimes you're dealing with two patients.
Yes. Okay. Thank you. Someone here says, I really want to get chubby. I don't know if this is a question for help. This is an SOS from the person.
Where do you want your BMI to fall? What you should ask her. What is chubby? Where do you want your BMI to fall?
Okay, so I guess this person will provide your answer in the chat, and then we can provide additional support. Or I'd encourage you, if you get subscribed to the MDoc Complete Health platform and get access to coaching and get access to some of our nutritionists and dietitians as well, who can provide that tailored guidance for you.
I must say, but she's right, because we do have people that are underweight, and that's unhealthy. We do have people underweight and unhealthy, but again, a guide to how to add that weight is better done with the one-on-one coaching and whatever to answer on a platform like this. Yes. So underweight is people that need to add weight, but it's better done one-on-one. You can.
Okay, so great. So like Dr. Chita has already, she's approved and signed and sealed my answer. Okay, so please get on board, get signed up on the MDoc Healthcare platform. We'll drop a link in the chat box so that you can get access to coaching that's tailored and that addresses specifically your numbers currently and how to get from where you need to get to. Okay. Quick question. Good evening, Doc. It's really impactful. Thank you. I wanted to ask, What causes the fingers to twitch or stiffen? Plus, sometimes the teeth feels too hard. Can inactivity cause this or a calcium deficiency? This is from a nursing mother. Okay, for a nursing mother. It's like a 3-in-1 question, but I held that.
Questions I don't like answering up. Well, I mean, I think because, you know, when you talk about all this twitching and whatever, could it be a deficiency? Yes, it could be a deficiency. But I'm careful to answer these general questions because of the fact that most times the clinical scenario is important, and what you're looking at is more than just, okay, this is a twitch. Okay, you know, of course, there are more questions to ask and all that. But if you talk about, sometimes I tell nursing mothers that sometimes the general common numbness or whatever it feels, where do you carry your baby? You know what I mean? All the time when you're feeding, which arm, which hand, do you understand? So you have things like that are just simple stuff that are not necessarily a deficiency. It could just be that that's the hand that you use the most, and then you recognize that. How do you carry your baby? What arm do you carry your baby? What's the position? You know, and whether that's the reason for the numbness and all that, or the twitching. But again, of course, if something that continues like that, then you have to get evaluated in the context, clinical context. It can be, it's not a one question and then see. You know, do you understand? So, I mean, if you have a platform for that already, so I guess she can always go into that context and say, okay, it could be something as simple as, where do I carry my baby? What arm? What's my position of sleep? How do I lie down? Do I lie on the affected side? And then why would she think she has calcium deficiency and all that kind of stuff? So I think it's important that she sees someone if it's significant like that, or she adjusts these little simple things I just mentioned and see if it makes you feel better. Because it could be a pinched nerve. So she can just check that out. Yeah.
All right. Thank you, Dr. Dr. Chito. There's a question here. We'll just take 2 more, and so we can go right into the post quiz. Someone is asking, how can we manage stress as women, especially work-related and home chores, if you don't have a house help? So this particular question is one of those practical questions around, you know, how we're managing stress and some of the things, identifying your stressors. So Dr. Chito, over to you, please.
All right. So first of all, I'll just say that now this question is good for me in the sense that I'm one of those super people that believe I'm a super person. And to be honest, I think one of the first things is wake up in the morning and organize yourself, just like I think I would tell someone in an office as well. If you don't have a house help, you have to tell yourself you don't need to do everything every day. You know, with this need of, I must complete everything, you don't. You could organize yourself to the point where, this is what I'm doing for the kids today. This is what I'm doing in my house today. Like, you must not do everything. And you might have to, and it's very hard not to have support, I know. And some people have reasons why they don't have any kind of support. Because I always tell people it takes a village to raise children, to do anything right. Yeah. But you must be able to sit down and tell yourself that it's okay. Like, I sometimes say things like, and this might sound really bad, but they're on holidays, you bathe them at night, and they sleep very well in the morning. Once you can clean them down, you don't need to go through the bathing process. You know how many kids, and their skin will not peel off. You know, so it's very important that you tell yourself exactly, wake up in the morning, this is how we're going to do today. And then you organize yourself that way. And I know that it all depends. I can't give you specifics. I don't know how many kids you have, what their ages are, how your house is, but you must say yourself, this is what I'm going to clean today. This is not going to be clean to that. These are my days for this. These are my days for this. And if you're working, you tie that also into your work frame when you're doing work. You just have to have a good time management. Time management is the core of your being able to cope and putting your kids on a schedule and structure. Because that's the only way, I think personally, and people may disagree, that you can survive this, is having structure. So the kids have bedtime, the kids have feeding time, so allows you to also have me time. The me time gives you the energy to process the next day and allows you to get your strength for the next one and next one, like that. Or else you're going to end up being burnt out, get frustrated, and then end up thinking, you know, oh my God, I'm a failure, when you're not, when you're actually a super mom or a super a woman, pretty much. So, but you have to organize. I think that there's something that I remember I learned from, and this is something I learned, I think it was from Maxwell or so, where he said there's A, B, and C in terms of priority, because the most expensive thing we have is time. So you have to now have what's your A priority, what's your B priority, what's your C, and you take it from A to high priority, medium priority, and low priority, and manage your day accordingly. I think this also applies to the house as well, that you have to be able to do these things. So me time is also part of your schedule every day. You need a me time. And I think that's important. That's that's all that comes to my mind at this point.
Thank you, Dr. Ochita. I think that's very, very practical and very holistic as well. The need to be to plan, right? Plan,
Yeah.
be structured, be intentional, recognizing that the work never stops, okay? The work never finishes, and then you can only do as much as you can in a day. And remembering that self-care is very important. Take time out for yourself as well. Yeah, a mom that's not
I'm
healthy
learning
can
that too. I'm learning that too myself. Trust
okay,
me.
okay.
So,
A mom that's not healthy,
question.
yeah. A mom that's not healthy will be unable to take care of the children, so it's important that you yourself. Yeah.
And even God forbid you're not there, this child will still live.
Well, fair point. Fair point. Thank you. Okay, one last question, and then we'll bring the question and answer session to a close. Someone is saying, okay, my question has probably been addressed. What's the likely cause of fluctuating BP from 130/90 to 140/90, and then 120/85, and then back? So this
I wish
question
I
is
had a cardiologist here. Don't mind me, I'm just so specialized. All right. So what is the cause of fluctuating BP? How do you know it's fluctuating? Are you taking it because when you take your blood pressure too often, you will have fluctuating numbers naturally. So is the person taking it like
curious to know if
constantly?
this person is currently
Person
taking
is longer, postpartum, after birth, or why? You understand? If it's fluctuating between 130, 140, both numbers being kind of a little bit elevated for a younger person, but is the person taking it at home? Because if you take your blood pressure often enough, the numbers will not be the same. I don't think anybody gets the same numbers when you take your blood pressure. So if it's fluctuating, it could just be one way you're taking it, or how you're taking it, or how often you're taking it. If you're worried about blood pressure, sometimes even they tell you take it now and then wait for 6 hours before taking it again. And sometimes even say come back the next day and then we'll take it again. There's a reason for that space. And sometimes, someone said the white coat effect. That's true. The white coat effect is really more if you come to the hospital. So someone will say my blood pressure is 120/80. When they now walk into the hospital, it goes higher. And that's because they're nervous, right? They're like, hey, what would it be? They're now conscious. And the more conscious you are, the higher it goes. I tell a friend of mine who's always say, I say, you took the first time, it was 120/90, you became anxious. And you keep taking it, it gets higher and higher. It's hard to tell what the problem is. So it's important that you and also breathing and relaxing and not taking it after maybe you ran or you did something very strenuous. You always have to be relaxed, take slow, deep breaths, and then take your blood pressure. So it really depends on how you're taking it and what you're doing around the time that you're taking it.
Thank you very much, Ochito. And well, just one more emphasis is, the importance of recognizing that this is so important. She's highlighted several times in her presentation, the need to constantly, monitor and check your health metrics regularly. And there's no one that's exempted from this rule, right? We need to ensure that we're actively checking our health metrics, or we're, having your regular checkups, wellness check with your healthcare provider, so that this is something that you're on top of. Okay, it's not something that catches you by surprise. And just recognizing some of the techniques. Yeah, go ahead, please.
No, I just wanted to, I know you're closed for a question, but I wanted to there's someone that's sickle cell disease here, asked a question about women with sickle cell disease.
Okay, anemia, yes, chronic anemia.
Yeah, and then extra clinical on how to optimize their blood levels, specific population. I think I will say that any patient that has sickle cell disease and is pregnant should be also seen by and with a hematologist. The reason I say this is because sickle cell disease has its own significant peculiarities of how to operate. So when you're not pregnant, we pretty much manage you the same way you're not pregnant. But when it comes to having crisis and stuff, it's very important that we connect to your hematologist as well. And we look at, and make sure that we're doing the right things in terms of either we're transfusing the right way. All these things are important. Apart from transfusion, we encourage you to have a good diet, but we also have to take a note that we don't want you to become have excess iron as well. So your diet is also, yes, is important. Doing the same things is important, but the doctors are normally very careful with your iron, how much iron you have as well, so that they check all those labs, and we check them again in pregnancy and work hand in hand with hematologists sometimes in this matter. Where we're on the field, where access to healthcare is limited, we also mindful of the limitations there, and we manage them again, of course, with nutrition, and make sure that at least they're not malnourished. We make sure that they're fine in terms of blood level. If not, we sometimes will pay and do transfusions as well. So it's important that the guidance is pretty much the same, but the most important thing for me is keying in to having a hematologist on board. Even if you have an OBGYN, there's something to do with specialties. Unless you can't afford it, then it will now become the doctor trying to get advice from colleagues and making sure they provide you with holistic care, especially that have a crisis, because we want to prevent crisis in pregnancy. That's one of the biggest goals, is to prevent you from having a crisis in pregnancy. So that's important.
True. Thank you so much. And thank you everyone for your questions and your answers. You made this session very engaging. In fact, we've gotten more knowledge, more learnings have come out from your questions. So thank you for contributing. We'll move right into the post quiz so that we can start to call today's session a close. Thank you, everyone. So I'm going to launch the poll right about now so that we can take the post test. From everything you've learned today, I'm sure you can't wait to get right at the question. So just confirming that you can see the polls on your screen. If you cannot see it on your screen, please let us know and we'll provide support. But we'd like to encourage everyone to take part in the post-test quiz. If you took the pre-test quiz, please make sure that you take the post-test quiz as well. This is just our way of measuring knowledge gain from this session. And don't worry, your answers are completely anonymous, okay? So thank you, everyone. Please keep your responses coming in. If you got bumped off and you're just joining us back, welcome back. We're currently taking our post-test quiz. We just had an amazing session delivered by our guest speaker, and we've had a round of questions and answers, just providing continued learning. But now we'd like to take our post-test quiz so that we can measure our knowledge gain. So please, if we'd like to encourage everyone, please participate. The poll is currently up on your screen, but if you can't see it, let us know and we'll provide that support for you. Thank you for your responses. Okay, so Oluwatosin is saying she can't see the post-test quiz. Oluwatosin, please, can you check below your screen? There should be 3 dots, a button for more, and just click on it and see if you're able to access the post-test quiz from there. Thank you to everyone sending in their answers. Please keep the answers coming in. We're doing good already. Thank you. I want to see more answers coming in for the post-test quiz. I want to encourage everyone, please make sure that you participate in taking the post-test quiz. I'm sure you've learned many things, from today's session, from that very engaging session, so many things you can take away. So please make sure that you are participating in the post-test quiz as well. Thank you. All right, we have just about 3 minutes to go. I'd like to encourage everyone, please make sure that you participate in the post-test quiz so that we can get in an accurate, especially if you took the pre-test quiz, it's important that you take the post-test quiz as well. So I'd like to encourage everyone to please take the post-test quiz. Thank you for your contributions and participation so far. This has been amazing. This has been wonderful. We don't take it for granted at all. Thank you. Two more minutes to go. Thank you to everyone who has responded so far. I'm waiting on everybody who is currently filling to finish. So we're just going to give you some more time to round up if you've already started taking the post-test quiz. Okay, we're running off in 1 minute. I just give an extra time for those who are already filling, just so that they can complete theirs. We'll round up very, very shortly. The train is about to end. Okay, and the poll has come to an end. All right, then. So we're going to quickly go through the answers to this quiz so that we can tell how well we did on the quiz. Just noting, Dr. Esther, just confirming that you can hear me and you're on the call so that we can run through the quiz questions together. Let me confirm that she's able to speak. Dr. Estella, can you hear me, please? Just confirming that you can hear me.
Yeah, can you hear me?
All right, great, wonderful. Okay, so we'll go through our quiz questions together, and then you can provide the response. Okay, so number one, which of the following is the correct reading for a normal blood pressure range? Option A, 130 over 85 millimeter of mercury to 150 over 95 mmHg. Option B, 90 over 60 to 120 over 80 mmHg. Option C, 90 over 60 mmHg to 140 over 90 mmHg. And option D, 80 over 100 mmHg to 120 over 90 mmHg. What's the correct answer, please?
Okay, so for this presentation, based on the guidelines that were used, the
Yeah.
answer is B, which is 90 over 60 to 120 over 80. But if we had to maybe use the Nigerian guidelines, that would have been D. So 120, no, not even D, because the Nigerian guidelines is 120 over 80. So the correct answer in this case is actually B, based on the
Thank you.
guidelines that were used. Yeah.
Okay, thank you so much. So for the second question, the following are symptoms of severe high blood pressure, except, so what's the correct answer here, Dr. Estella?
That would be weight gain, which is C.
C, weight gain. Thank you, everyone who would take this option. Number three, which of these factors puts you at risk of anemia? Remember that Ochito highlighted this specifically a lot, particularly for women of reproductive age. So what's the correct option here, Dr. Estella?
All the options would put you at risk, so that should be D.
Yes, all of the above. Heavy menstrual periods, pregnancy, chronic disease, all this puts women at risk of anemia. Okay, number four, which of the following is an incorrect?
I just wanted to add that. So yes, exactly.
Sorry. What did you say?
Dr.
Dr.
Chito is back.
Here.
Yes, thank you. All right, so for number four, which of the following is an incorrect reason for why it's important to understand and track my blood glucose? Option A, helps me manage my energy levels. Option B, to determine my blood type. Option C, to manage and help prevent diabetes. And option D, informs my understanding of how my diet affects my overall health. Dr. Stella, what's the correct answer, please?
That should be B. Knowing your blood glucose doesn't help determine your blood type.
All
So
right, thank you
B
so
is the incorrect answer.
B is the incorrect. I know that this might have been a tricky question because of the word incorrect there. Someone else might have thought it was correct that it meant. So thank you so much. Number five, which of the following is the correct option for abnormal fasting / post-meal blood glucose reading?
Do you want to read the options or I should just go ahead?
Okay, you can go ahead and just mention what the correct answer is.
Okay, so it's we have to mention the abnormal fasting / post-meal blood glucose reading. So that should be D, a fasting of 1.5 milligrams per deciliter and a post-meal of 180 milligrams per deciliter.
All right, thank you so much. Number six, BMI, also known as body mass index, is an indicator of what option?
A healthy body weight, which
A
is
healthy
option B.
Okay, thank you so much. Number seven, the following are symptoms of poor mental wellness, except, this is a tricky question.
Except mindfulness.
Mindfulness. Remember that Dr. Chito highlighted this as something that you can practice to promote optimum mental
To
health.
improve your mental well-being. Yeah.
Yeah, thank you so much. Number eight, which of the following options is correct about BMI readings?
Okay, so that should be underweight, a BMI of less than 18.5, normal weight, BMI 18.5 to 24.9, overweight, BMI between 25 and 29.9, and obese greater than or equal to 30. So that should be option A.
Thank you so much. And thank you to everyone who take this option as well. We have 2 more to go and we're rounding this off. Number 9, why is it important to monitor my health metrics?
The options here, all the options appear correct. So crucial for early detection of potential health issues, empowers you to make informed decisions about health and lifestyle, and manage existing health conditions. So option D for
So
all
it's all of the
is
above,
correct.
correct. And then the last question, a practical tip for monitoring health metrics is, this is one of those seemingly tricky questions, but what's the correct answer, Dr. Estella?
Using a tape measure to gauge how healthy you are, assessing. So none of the options
This is correct.
in
None
this
of the
case
above.
appear to be correct.
None of the above. I figured that this might have been a tricky question because it had some of the things that one would think are important, but none of the above is correct. And from what we've learned from our speaker today, practical tips for monitoring your health metrics do not include monitoring how well your skin glows or using a tape measure to gauge how healthy you are. All right. Thank you, everyone, for participating in the polls. Thank you so much. We're bringing the session right up to a close. Please, can we move the slides, please, so that we can wrap things up? I'm going to go right and share our poll, our reaction survey, so that we can just take just 5 questions. And we would like to know how you enjoyed the session. If you have any feedback for us, please take the time to take just 5 questions. Would really appreciate your responses. Thank you so much, so that we can improve our delivery of these sessions. Okay, I see that some people are already done with the poll. Thank you so much. Two minutes to go on our reaction survey. I would like to encourage everyone, please, let's get your insight on on your reaction to this session. Did you enjoy it? Did the training meet your expectations? Would really appreciate your feedback. Thank you so much. All right, we're ending the poll right about now. Thank you very much, everyone. And next slide, please. Dorothy, just confirm that you can hear me. Okay, great. Okay, so thank you everyone for participating at every point we called you to participate and contribute. You did. Thank you so much. I'd like to encourage you to stay tuned to more of these sessions, because we're on a mission to keep equipping everyone, women of reproductive age, with the knowledge and the tools that they need to better manage their health and take control of their health. So follow us on our social media platforms: Facebook, Instagram, Twitter, YouTube. We're streaming this session via YouTube, and we'd like to acknowledge all our YouTube attendees. Thank you for joining this session. Thank you for participating as well as on LinkedIn as well. So just stay tuned, and there's more where this came from. Okay, next slide, please. All right, I think we can just keep through this because our time is fast spent, but we'd like to remind everyone, you can sign up on our Complete Health platform. If you're an Android user, we're on Google Play Store. If you're an iPhone user or any other kind of phone, please go sign up on www.mymdoc.com to get onboarded on the platform and get access to coaching support so that you can be in control of your health metrics and manage your health. Okay, NaviHealth as well, encouraging everyone. You can get access to facilities nearby you on NaviHealth as well. Next slide, please. Next slide. All right, and we've come to an end. Thank you everyone for making this session very wonderful. Special thanks to our esteemed guest speaker, Dr. Chiso. This was a very enlightening, insightful session. Thank you for sharing. Thank you for the very practical tips that we can all leave this session with to help us be in control and better manage our health and improve, outcomes both for maternal health, both for everyone really who joined this session. Thank you so, so much. We are truly appreciative of your didactic presentation and your contributions to improving health outcomes. Thank you very much. Thank you everyone who joined our session. We hope that you have had a wonderful time, and we look forward to seeing you at our next session. Thank you so much.